When I first got to the Ministry of Health, a lot of the internal discussions in the health system was about competition between the two healthcare systems. And many people really were asking, why do we have this competition? It really doesn't make sense to have this sort of competition. And as we got into it, we recognized that while there were areas that people could legitimately and should legitimately compete so that they can do better, actually there are many issues where the Ministry of Health family needs to operate as one family, or in management lingo, they actually need to operate as one integrated system. So while you can have separate hospitals, separate polyclinics and specialty centers which are treating patients, in certain areas you really do need to operate as one integrated system where issues are looked at coherently across the whole system. And one of the first issues that became very obvious to Iguan and me was in the area of IT. Because if you were going to build a national electronics database, you really did need to, clinical database, you really did need to make sure that data could flow from one system to another. And it would not be the right way of competing to say that patients are owned by one system and their data cannot flow to the next system. That's not actually good for patient care. So when Iguan had done a lot of work prior to my arrival on the first generation of the National Electronics Medical Record System. And when I arrived, we went into a more full-blown effort to do that. And it became quite obvious that the IT systems of the healthcare institutions really did need to be built on the same basic sort of architectural platforms. Different hospitals might have different needs to be met, but nonetheless, the data needed to be able to flow. So it became pretty obvious to us that while the ministry headquarters is set up to do some of that integration, the ministry headquarters is better set up to do policy thinking, in some cases to do clinical regulations, which is also a form of policy. But it really was not set up particularly to do healthcare ops. And there was a need for a capability somewhere in the healthcare family that looked at integrated operations. And because Ministry of Health Holdings already existed, it seemed logical to use that as the platform. At that time, Ministry of Health Holdings was essentially a paper company because it existed legally, but it had no staff. And what we did was quite simple, was simply to make it a real company again, where we sort of put staff into it. So Iguan was my deputy secretary, and because he was handling a lot of the operational issues, it made absolute sense, and he was very keen to take on the challenge of putting together some of these integrated operations. So we started with IT, and I think the next area we worked at was building infrastructure. So we had recognized when we were dealing with individual healthcare institutions that some of these issues were not just handled at the staff level, they also involved the boards of directors of the various health systems. So one of the things we did with the MOH holding structure was to draw in the chairmen of the various hospital groups onto the board of MOH Holdings, where they could sit together and discuss where were the health systems trying to go together, even while they might have many issues that might be localized that they will handle at their own board levels. And I think it was fortunate for us that we had a set of absolutely wonderful, visionary, strong leaders, chairs of the healthcare systems, who were able to work as a strong team and were very happy and willing to come together. So I was very grateful for that.
Okay.
So we also then got various members of their boards who had specialized in certain areas to also come together at the MOH platform so that they could also bring an integrated perspective to the areas that they were experts in. So one of the groups of people who then formed the IHIS board were really the people who served on the individual hospital boards who were IT experts. We then, I think subsequently, put together another, I suppose at that time it was a committee, which was then looking at building infrastructure. So they had been looking at the buildings that they were doing for the various health system boards that they were sitting on. And Iguan pulled them together to then look at what might be our broader needs as a healthcare system, and could they advise us on how we build an infrastructure development capability. So I think it was around the time that I was transitioning out, but I think one of the sort of amazing things that Iguan did was to really build what I would call a sort of big property development company, which is really what I think a big part of what MOH Holdings is today.
Yes.
And I think that's absolutely amazing achievement. I remember that in the earlier days, we had asked individual members of the boards or individual sort of business leaders who had property development expertise to help with certain projects. I think Mr. Philip Ng was asked by the Minister of Education at that time to help build the Duke Graduate Medical School. And we likewise asked a few other friends to help build some of our new hospital sort of buildings. And they really pointed out to us that while they could be helpful and they were perfectly willing to do national service, this really wasn't the way to do it. They could give advice, but they really couldn't end up taking over the responsibility for the actual development of the projects. And they said, you know, you really do need to have some staff. So I think that's how Iguan started building the core of the team, and now he has a very strong team.
Very strong. HIPD, we call it, Healthcare Infrastructure Projects Division. Yes. Good. Did you at any time think that there would be the MOHH of today? Like you said, you started off thinking about IT and certain synergies, but now we look at finance. We've got a central treasury with a central liquidity management system. We've got audit, and the way MOHH has grown. Did you envision it that way? Did you have that kind of plans in the long term?
I think that MOHH has evolved, and I think it would not be right to say that I had anticipated sort of all or most of this. I think in terms of some of the areas you mentioned in the question, I think some of it we had anticipated, but probably not necessarily at the scale or the depth that now clearly seems to be in place. So in terms of finance, we had always anticipated the need to have, at that time, an investment committee that looked at the investment of the reserves of the health systems, because it's an area of professional capability. It's not an area for amateurs, because you probably end up losing half the money you invest. And I think there was a sense that it would be best if this was managed by a team that the government would regard as professional, which did not include either Iguan or myself. And Mr. Peter Sia, who is chairing Sing Health, very kindly agreed that he would do us another favor and help drive the investment committee for a time, and eventually transition it to a team that sort of looks at this professionally. But we thought that was better for the individual health systems, rather than they have to try and manage their own reserves.
Excellent.
In fact, we had been quite ambitious and looked at other options, whether we could either get the government to do it for us, which they refused, or maybe we could partner with the universities. And I think various options were explored, but I think eventually the Ministry of Health said, these are all actually good ideas, but in the meantime, let's get going.
Sure.
So I think we got that going.
Excellent.
So in the sense, some of it like internal audit, finance, financial investments, and IT and buildings were anticipated during my time. But I think what I would be safe to say I hadn't anticipated was the scale at which these operations would grow.
Yes.